America's largest elderly population lives right here in California, 3.7 million people over age 65. More and more of those senior citizens are living in residential and skilled nursing facilities, and while most of them receive very good care, a staggering number of them are being abused and neglected and even dying at the hands of the very people who are supposed to be keeping them alive. Judy thought she was doing the best thing for her 82-year-old mother, Martha, when she put her in a residential care facility. But within 3 weeks, she began noticing some problems.
By this point, I had observed enough within the facility to see that it was clear that they were understaffed.
Then Martha told Judy that she had been burned after an attendant left her in a hot sitz bath for 40 minutes instead of giving her 2 20-minute sessions.
My mother recounted that she was sat on the sitz bath and she felt that the water was too hot and it hurt, and she cried and she said, "It's too hot." And the girl said, "Don't be a crybaby," and left the room.
The pictures you're about to see are very disturbing, and you may want to turn away. Martha suffered a severe burn across her backside. That soon turned into an open wound so painful she could barely move. What was your reaction, Judy, the first time you were actually able to see the wound?
I'm still traumatized. I was sickened. I was devastated. I was in shock.
It took 2 weeks before the residential care facility transferred Martha to a skilled nursing facility where she could get wound care. But by then, it was too late.
I realize now, I know what a dying person looks like, but I'd never seen anybody dying. And the room got quiet after a while, and I looked and she was dead. She died.
Judy sued the residential care facility for neglect and wrongful death. Instead of facing a jury, the facility opted to pay an out-of-court settlement. But her heartbreaking story is just one of the many elder abuse cases that attorney Randy Walton handles every year. He says abuse and neglect is occurring in shocking numbers at elder care facilities on a number of levels.
The big problem is neglect, and that is neglect that is poorly staffed facilities, facilities with poor training, facilities who have non-healthcare professionals making healthcare decisions for people.
What happened in Judy's case is something Randy says he's seen time and time again. Residential care facilities not sending their senior clients to a higher care facility until it's too late.
I have found that many of them are so eager to retain the resident, the cash-paying customer, if you will, that they often ignore the changes of condition, the declining health, the problems that are occurring, and it's until it's too late that they get the proper care. In fact, I've seen that many, many times now.
People who need real medical care should be in skilled nursing facilities, but attorney Bill Berman says many of them are having trouble finding well-trained staff. He told me about a case where the nursing staff became annoyed by a patient who had been throwing up all night.
The CNA went into the resident's room, tied her call cord out of reach.
All I remember is when I guess I wrapped it up, or I didn't know if I pulled it or wrapped it up. She says, "No, no, no," you know.
Unplugged her private pay phone, pushed her wheelchair to the other side of the room, turned off the lights, and shut the door.
A few hours later, another staff member found the woman on the floor choking on her own vomit.
She had dry residue all over her face.
The director advised the staff to leave her there and go attend to the others, stating, "We know she's been there all night. She's been a pain in the ass. Just leave her and go attend to the others." And the woman ended up dying after choking on her own vomit.
Even after testifying about what she had done, the nurse's aide was not prosecuted and went to work at another facility. At a skilled nursing facility, it's not just the staff that's important, but also the equipment that they use. For instance, a bed rail is meant to keep a patient safely inside the bed. But if it's not fitted properly, the results could be deadly. This woman strangled to death on a bed rail that was not installed properly.
They are the cause of many, many deaths every year.
In California, over 225,000 cases of elder abuse are handled by various protective service agencies each year.
We will receive calls through our hotline for residents of various facilities around the county. And depending upon who the licensing agency is for that resident or for that facility, we'll refer that call over to that agency so that they can begin an investigation.
So why aren't we hearing about all these abuse cases? Elder advocates say one reason is that many families settle with the facilities and sign confidentiality agreements. Another reason is that the agencies assigned to investigate abuse and neglect complaints aren't.
There are a vast amount of complaints that don't have enough investigators to be investigating the complaints to make sure that the facilities are complying with the needs of the residents.
A staggering number of residential living and skilled nursing homes are in violation of federal health and safety standards. The U.S. General Accounting Office reported that 1 in 3 California nursing homes was cited for serious or potentially life-threatening care problems. They included staff mistreatment of residents, medication errors, accident hazards, and employing convicted abusers. Elder advocates are demanding major changes being made to the elder care inspection and licensing system.
I think until the public realizes that there's a big problem in our facilities with understaffing, with a lack of care, with significant acts of abuse and neglect, things are only going to continue to happen, and our elderly are not going to get the care that they deserve and need.
Volunteer ombudsmen try to pick up the slack by going to facilities and talking to residents on a weekly basis.
We are advocates for the resident. We have to make sure that the residents are being treated properly, that they're getting everything they're supposed to be getting.
But in the end, it's up to the people who work in care facilities to do what they promise, take care of our loved ones. The Country Villa in Rancho Mirage is one of the only skilled nursing facilities in all of Riverside County to receive 0 deficiencies by the Department of Health in its 2007 inspection.
We have very good systems in place. We do a lot of education in this facility. It's monitored very closely, shift by shift. We do report at the beginning and end of each shift just to make sure that any issues are addressed immediately.
The director of Atria Palm Desert says you can see the good level of care his residents receive right on their faces.
A happy resident is an indication of the overall operation itself.
Judy hopes her story will compel caregivers to take their jobs more seriously and inspire family members to cherish every moment with their beloved elders.
Have enough compassion for them to be there for them. Don't just leave them there.
Research in California has found that 23% of facilities were responsible for 70% of the neglect and abuse lawsuits. But that number could be much higher if more people reported incidents and spoke out about what happens to their loved ones. If you would like more information about the signs of elder abuse and what you can do to get legislation changed, log on to our website at KMIR6.com. Back to you at the desk.